Hi, everybody. Welcome to Healthy Aging Workshop Week 3. This is Eastern Medicine. This is one I'm very excited about, and I'm newer to understanding this topic. I've only been aware of kind of these practices the last few months. I have Alethea on the call. She is my acupuncturist. I went to her when I was honestly at my last wit and pain. My doctor, my OBGYN, I have stage 4 endometriosis, and she didn't have many options for me. And she finally threw in after just like, I'm tired of having 10 days of pain a month. I'm tired of like crying and being in a robe and feeling miserable 10 days a month. And she's like, well, maybe go try acupuncture. And I thought, okay, really? But I had no other options. So I did some research. I came to Alethea and I just jumped right in because something about her, she knows her stuff. She's aware, she practices herself, and she gave me a calming sense that I can go ahead and go forward. And I trusted her. I went in, and I'm happy to report after just a couple of months of going through acupuncture for my endometriosis, I'm a whole new person. Even my husband, who is like, acupuncture, really? He sees it. I don't have pain days. I'm just getting out of another cycle, and I've been stressed, and I don't have pain. It's crazy. And so I'm excited to have her on the call. So if you guys know anybody, or you're at your wits into something and you don't know where else to help, I'm hoping that you can find help like I did. So welcome to the call. Thank you for coming, Alethea.
Thank you for having me.
So tell us a little bit about your background. What led you to Eastern medicine? What is the training like? You know, tell us a little bit about yourself.
So my name is Alethea Jones. I'm a licensed acupuncturist. I got a master's degree in Oriental medicine. Could also be considered traditional Chinese medicine or Eastern medicine. These three phrases are used interchangeably as we navigate the political correctness within this country. The program itself is about 3.5 years, and what led me there is I was already practicing natural medicine to a degree. I was practicing herbology. I was working on my own nutrition. I was exercising, and I had come from a history of having a lot of imbalances in my lifestyle and my nutrition prior. And just over years, I found that I really was gravitated towards acupuncture. And acupuncture is the thing that, like yourself, Cam, I had a situation with asthma in my respiratory system where the doctors just knew that steroidal inhalants were what I needed next, and I didn't want to go that route. So I went through with Western herbology, which a lot of people are familiar with. And in regards to the use of one single herb, and then I had an acupuncturist, and in one acupuncture session, the practitioner linked my emotional to my spiritual to my physical and my mental. It kind of linked all of these things across the board, and I felt empowered when I was done. And I am grateful that your sensation and your takeaway was also that you felt empowered and that you had choices. That's the largest thing that I like to relay to my clients, is that they're in control. You have so many options. Your body is so capable of its own healing potential. And so that's kind of how I ended up in this field in a quick nutshell.
I love that our bodies do have healing powers. Our bodies are temples. They're incredible. We're designed to heal and do miraculous things if you can get your body back in balance. And I love that you found that journey too. A lot of us have found these empowered states because we've been sick ourselves, and we want to pass on what we have found. That's incredible. I love that. So let's talk a little bit more about the training. We hear about doctors going to medical school. They go to medical school for a couple of years. They do rotations. What is a master's in Oriental medicine like?
So there's a couple of degrees, first of all, that somebody in my position might have. They might have a master's degree. They might also have a doctorate. And so the difference between those two is, one, you're a doctor. we can actually be referred to as labeled as doctors. So even if I had a doctorate in the state of Utah, I am not a doctor of Oriental medicine or Chinese medicine. I am specifically a licensed acupuncturist. So across the various states, there is going to be a varying level of licensure and title that goes along with that. The training itself, for a master's in Oriental medicine, as I said, is a 3.5-year program minimum. It is the longest master's program in the country. So it's longer than, it's essentially a doctorate, but with a master's label to it. And I think part of that's because there's a lot in there that Western medicine and even myself as a person going into this medicine don't understand. And there's a huge barrier difference. So part of the education in that 3.5 years is learning the language of pinyin, which is essentially the handwritten script of English letters to Chinese words and glyphs that are actually written. So translating those words and understanding what they're connected to. So there's a little bit of a language barrier with this program because it is taught on the principle of a traditional medicine. So that I think adds to the length of the program. That language comes in with the component of learning about herbology, especially. So we practice Eastern traditional Chinese medicine, and those herbs are going to come from different parts of East Asia, Japan, Korea, China, Mongolia. Some of these herbs can also be found here in the United States. So there's a large degree of herbology that goes with it. And that's most master's programs. Every master's program or doctorate program is going to have a different focus on things. The one that I went to was heavily focused on the herbology, and it also was heavily focused on the biomedical component. So actually getting training as a primary care physician and understanding what the red flag markers for concerning things are, just like we're looking for red flags with the current coronavirus crisis, associated with our regular health systems. And so learning those red flags, learning regular symptoms that go along with various diagnoses such as endometriosis, fibroids, knowing how to work with the tests, images. I have an understanding, although I do not at the moment send out for images or send out for blood work, I do completely have an understanding of how to read those things. So there's that biomedical component within my training that's very strong. One of the internships I did actually was within a hospital setting using acupuncture for both inpatient and outpatient hospital setting clients. The other components are going to be acupuncture, which is what we administer quite frequently, especially here in the state of Utah. As I said, I'm a licensed acupuncturist in the state of Utah. And so acupuncture is going to be the use of energizing and stimulating the body to bring balance and harmony into it. So we work with two main foundational components, and that's qi and blood. Qi you could also translate to prana, life force, Brahma. It has multiple references cross-culture. So qi is that life force, it's the vitality, it's the actual movement of energy in the body. And the blood is going to be linked into everything. Blood is critical. If we don't have blood or if we have too much blood, then things are going to be affected. Let's see, so that's acupuncture. And what we do there is we insert little needles. They're very small. They're not too abrupt. Sometimes they can be larger than others. Sometimes we create a stimulation. Sometimes we place them in and let them relax. Is it painful? No, it is not painful. Most people report feeling very calm and relaxed during acupuncture. There can be moments of stimulation. Sometimes we may want more than others, depending on the circumstance. And then the final component to this master's degree in Oriental medicine is that we do physical bodywork stuff. So Tuina, which is a form of massage, qigong, which is a movement exercise. You can think about tai chi. Qigong is going to be the root from where tai chi, the martial arts, formed out of. And then there's also medical qigong, which I would most closely translate that to as an energetic, like a Reiki practice. Physical therapeutics are gua sha, which is literally a scraping technique on the skin to innervate the tissue. And then, of course, we do cupping. There's a form of moxibustion, which is a warming therapy, and even electrical stimulation can be applied into these things. So it's a broad array of offerings that somebody in with my degree might offer.
It's actually, it was crazy to walk into your office and realize that it's a whole new way of thinking. I feel like you were the first person that looked at my body as a whole, not just my illness. You looked at how's my mindset doing? How's my appetite doing? How's my bowels doing? How you looked at me as a whole, as a person, and like, what do I need to release to get better? And it's very fascinating, the thought of that you have the chi, but then you also have the blood stimulation. I wanted to talk a little bit about that because last week, guys, we talked a lot with Catherine Kipp about getting your blood work done and checking stuff in your levels for hormones and things, because the blood is everything. Your gut is almost like your moat around your castle. It's trying to keep things in and out that's not supposed to be there. And when that moat is gone and things are rushing into your bloodstream, that's when things happen. And it's really important. That's what this is. What I really liked about traditional Chinese medicine, or still love about it, Eastern medicine, is that it focuses on the blood, which is what brings nutrients to your brain. It removes toxins out of your body. It's everything. And circulation, how your heart is beating, everything is I feel like that's what my newfound excitement is, to learn more about the blood and blood work, because Eastern medicine is so much of like what's really going on, what's in your blood, what's not in your blood, and where's it going, and let's stimulate it. It's been pretty crazy to get to know it, and I still look forward to learning more. So tell us a little bit about how acupuncture works scientifically. Like if you had to explain medically or scientifically, like what's happening when you insert a needle in specific points of the body. What does that mean?
So I want to touch on one thing really quick with what you were saying before. There is a very foundational premise from which we're thinking about blood in Oriental medicine, traditional Chinese medicine, or Eastern medicine. Again, they're all kind of the same thing. And that is that qi, the energy, the life force, moves the blood, and the blood carries the energy. So for the blood to be carrying the life force and the vitality, and for the life force and vitality to be moving smoothly, you need both a healthy substrate of each. And yes, absolutely, what you were talking about with nutrition, with the digestive system, all of that goes into very deeply how this medicine works to bridge and bring those two things, the chi, the energy, and the blood together. And what acupuncture does is acupuncture actually manipulates both of these things. It manipulates the chi of the body and the blood of the body. And there are other things that come into play with this. So when I say that acupuncture manipulates the chi or the blood, it doesn't just release, as you had mentioned. The acupuncture needles, when they go in, there are points that can either build the body, say you're an anemic and your body needs more blood actually built up, or you're lacking red blood cells, or say you are a hot-headed, hypertensive individual. That's too much blood, it's too much pressure. There might be some cholesterol. So we can reduce the extra that's going on. We can calm down that too much sensation. Or if there's not enough and it's just can't pop up, the acupuncture will actually help to build it up to a more balanced level and state. So acupuncture, the way that I like to explain it to people, and I feel like it's the easiest way, and you know, acupuncture, we are the redheaded stepchild of the medical industry. We have lots of scientific proof that this works. We have thousands of years of proof that this works. We have thousands of years of papers and publications and everything. But if you look at a lot of Western doctors, they're gonna, as you saw, Well, you could try it, but they don't really know why it works. And the reality is that Western medicine is based off of scientific reviews, literature, quantification, not qualification, but quantification. So they want the numbers, they want the hard data, they want the criteria. When you're looking at the body and the symbiotic relationship that the system has with its energy and its blood and how everything moves, it's hard by that. So how I like to explain acupuncture, well, what I will say is that while it's hard to quantify, there are more and more studies coming out which do prove that this medicine is helping. The big things are going to be in the reduction of inflammation and fever or heat sensation. And the other thing, most recently, we are approved now. And again, this is the very beginning baby steps. Acupuncture has been practiced in the US since the 1960s, but really we just are actually approved for Medicaid for lower back pain just within the past year.
That's awesome.
So we're really on the forefront of actually digging in as a profession and able to really enunciate and share what we can. In regards to what the needles do. So the acupuncture needles are, and I'm going to use a pen to show you guys. So essentially you take a needle and you would place the needle into the body. Now, when something goes into the body, your body has an immediate immune response. It lights up a red flag. Your immune system goes, whoa, whoa, foreign invader in the body. It doesn't know at that point whether it's a splinter, whether it's a metal, whether it's a bite, whether it's an infection. When the immune system gets responded, it just knows that something has altered in the body. Now, in this case, the needles that we use, that we put in, are surgical steel, surgical stainless steel, and completely sterilized. Needles only get used one time, and then they are put into a sharps container. So we do not autoclave needles in this country. It's completely illegal to do that. So when the needle goes in, it triggers the immune response. Body goes, whoa, whoa, foreign invader, and all hands on deck. They go to that location. So when they go to that location, after thousands of years of observation and documentation and looking at what points affect what, the body actually has what has been found, an automatic response mechanism. What I mean by that is, if you guys have ever heard that thing where if you have a headache, you rub right here on your hand. Well, this location here, it's on the back side of your hand, on your thumb. And if you ever have a headache, it's a great location to press. So this is acupressure. If you come in to see me, I'm going to take a needle and I'm going to put that needle into that location. And that location, again, after 4,000 years, this acupuncture was developed about 4,000 years ago, about 4,000 years of observation and recording, we know that this point is beneficial for the head and the face. So when we utilize locations based off of what they benefit, it's going to trigger that immune response, and the body is naturally going to start working on whatever it is that that point is going to indicate. Now you can use some locations intermingled. So for example, if you use this point, as I showed you before, along with the same point on your toe. So if you're looking at this as if it's your foot, this would be your big toe, and then you have your 4 little toes. Well, your big toe right on that spot is going to be the opposite point. So this on the hand is a large intestine point, and the one on the foot is a liver point. These points together are called the gates. What they do is they greatly increase circulation in the body. And so that's going to be kind of where it's coming from. So acupuncture, 4,000-year-old practice in development. Oriental medicine in general, the way that the Chinese, Japanese, Korean, Mongolians, all these cultures in Eastern Asia and Asia, they look at things from a very climatic standpoint. So is it day, is it night? Is it hot? Is it cold? Is it wet? Is it dry? And they're going to look at these things, and the acupuncture is developed off of that level of observation. The herbology component is developed off that level of observation as well. And some would say that acupuncture was developed off of the herbology, which is, the herbology is about 6,000 years old. So the immune response gets triggered, the body naturally does what it needs to do, whether it's decreased inflammation, increased circulation, primary things. So if you're increasing circulation to, say, a tissue that has a tear in it that needs to be repaired, stitched back together, you would increase circulation. If that area is acute and it's hot, then you would decrease the inflammation before you actually try to bring the circulation into it. So there's two ways that you're going to go about that. And I hope that answers it. It gets a little tricky sometimes.
No, it's actually fascinating how to look at the body. We talk a lot, you know, inflammation and immunity. Immunity is a buzzword right now, but weeks ago when I came in with my treatment for guys, endometriosis is basically the lining that women shed every month. Mine doesn't shed it, it reabsorbs. Those cells can go and travel and attach to my appendix. I have stage 4, so that means it's all over down there. And so every time of the month or when my hormones change, they light up, they inflame, they get irritated. And so what was cool about this practice of medicine, you came in and you gave me life skills, like self-care skills to feel better. She talked about a moxa ceremony, just bringing heat because my body is colder. I'm more hypothyroid. A few things she taught, I don't have ice in my smoothie anymore, just by increasing, we need to keep warm circulation going to my uterus. So drinking cold things doesn't keep the circulation going. Putting heat on me at different points of my cycle helps my body stay warm so it can slough off those cells. And it was incredible, the results. I mean, I won't go into too many details, but I used to feel like I was in part of Braveheart scenes before I started seeing, and I have regulated so much. I am calm, and it's amazing what I got to see cycle after cycle, tactic after tactic, little lifestyle stuff. Anything from don't have ice because that will make your body cold. Nobody would have ever told me that if that's because in traditional Chinese medicine, you look at the body as, are you hot? Or are you cold? And that's how she looked at me, and she realized that I needed to remove some things. And it's crazy to think I don't even get cramps anymore. I mean, it's insane. That's the only offer. So it seemed a little crazy to me when I walked in, but when you think about it, and it is true, whether you're walking down the street and you get a big splinter in your foot, your body's going to send out some messengers to check out what's going on. And after acupuncture, she directs me to go and eat really well because everything's stimulated, your blood's circulating. So go eat really good foods, because you want to give, if you're going to try to repair some tissue that's just been stimulated, you want to give it great ingredients, healthy things, salads, omegas, not sugars and things like that. So it's the holistic approach that I just feel my body has accepted and said thank you for. So that's awesome. I didn't know about Medicaid and lower back pain, because whether it's autoimmune or depression or gut health issues, or even just like repairing after an injury or surgery, sending intention to that body, it's crazy. So I want to talk a little bit about longevity and healthy aging and traditional Chinese medicine. Tell us about their philosophy and their keys to healthy aging and longevity.
So there are thousands of years of philosophy on just this alone. So I'll kind of stick it to where you were saying how we can work on not just as approved by Medicare and Medicaid, and actually it's Medicaid, I believe, lower back pain. So not only are we working on physical pain, but we are also working on emotional, mental, and some would even say the spiritual health. And that's because we are a composite of all of these things. We're not just granular tissue. Our granular tissue is affected by our emotions, by our heart, by how we put ourselves out there, how we hold ourselves back. So there's a lot of stuff that goes into play with that. And certainly lifestyle, as you said, is a huge component of that. So yes, we do touch on that in this medicine, and nutrition as well. Those things are so critical. In regard to longevity, when you look at all of these things, if you have a balance of your physical being, your mental, your emotional, and your spiritual, and you're constantly nourishing all of these things just a little bit, not to where it's stressful, because that would put a strain on your emotions, and that a strain on your emotions might put a strain on your physical body somehow, and that strain on the physical body can then go and affect your mental attitude, which can then affect your spiritual attitude and approach. So all of these things being interconnected and finding a nice balance with all of it. Acupuncture, because we are keeping things in circulation, things moving, a nice flow, a steady, things circulating, being calm. I really love the idea of Qigong with this. And they find that Qigong is very beneficial in the later years because you're moving the body, you're moving it around. You're not just sitting there like this. All day long, we sit on our computers and we type and we write and we're on the phone and we do all these things that are very constricting. So acupuncture, Oriental medicine, TCM, whether it's the herbs, the physical component, the nutrition, the lifestyle, the acupuncture, it's all going to approach the body to keep things in circulation, to keep it soft, to keep it gentle, to keep it afloat to where it wants to be. The body it's not meant to feel heavy. It's not meant to feel constricted. It's meant to feel light and airy. And that is a very foreign concept for a lot of us. But it's not also on that light and airy. It's not meant to feel like it's coming out of you and that you're losing yourself or you're not connected. So there's still a very good grounding that takes place, of bringing the body into a central consolidation. And as I do this, I literally, when I talk about central consolidation, I'm literally sitting here going central consolidation. I'm bringing it into my abdomen and holding it there. So it's all about bringing that energy into what is called the dantian, which is your lower burner. It's your source of life. It is literally where the umbilicus connects to the body. So when we're in embryo, we're nurtured and fed through the umbilical cord. When we are an adult, when we're born, that umbilical cord is cut and we take our first breath, and we're now part of the world around us, not just the world that we are naturally being fed, but we still have our energy, and consolidating it and holding it and knowing that it's central and stabilized is so important. And that's where that feeling of not feeling too heavy and too bogged down and not feeling too out of the body or too uplifted or too anxious, stress, anxiety, too tense, but finding that nice balance of movement and fluidity. That is, I would say, the basic presence of where longevity is going to come in from, if I were to have to distillate it for you really quick.
I agree. It's not just, we talked a little bit last week about being the fight or flight syndrome. When you're stressed out and have anxiety, you have to find that balance. And as the next few weeks transition to the healthy aging workshops, we're going to move more into the practicality of it. What can we do? What kind of fermented foods can we eat? How can we relieve stress? And I'm excited for that. So, I want to touch really quickly on herbs before we go to we're going to do a live demo on she's going to she put something together for us today, but I wanted to talk on herbs. And the reason why I didn't want to talk a lot about it, because I don't believe, and I think you might agree with me, that you can't go to the internet and just grab yourself some herbs and like find autoimmune. I've got Hashimoto's, I'm going to order myself that. Good. Herbs are powerful. They're made from plants. They're potent. And I encourage people to work with somebody who is a trained professional on herbs rather than go diagnose yourself, because they are so powerful. But I wanted to talk a little bit about that because I did, during this treatment, I got some herbs and I couldn't read the bottle. I went home and Googled it, and it was crazy. These things have been used for centuries for women with menstruation pains and this, that, and the other. And I believe it was a critical component in helping me release some of my endometriosis. Can you talk a little bit about the herbal component?
So herbology in Eastern medicine is different from herbology in the West. And when I say the West, I do mean North America, South America. There are some indications in the Americas where we're using the alchemy and the interaction of different plants together. But it's not quite to the extent that it's utilized in Eastern medicine. And that's where Eastern medicine, you're going to look at one plant, its roots, its little roots, its big roots, its stalk, its leaves, its flower, its seed, its whatever the part is, and whatever that part is through the different seasons. So one herb, for a good example of this could be cilantro. As a plant, leafy green, cilantro. When you let it age and go to seed, you now have coriander. So those two things are going to be a little different. Coriander is a little bit warming to the body, great for digestion. Cilantro is a little lighter, helps to break up. It's not so hot. Plants have a temperature to them, no matter which side of the aisle you're on. And so what we do with herbology and Eastern medicine is we look at what parts it is, and then there's an alchemy of how those parts mix together with other plants, or if those parts are prepared in a certain manner. Are they fried in wine? Are they dry? Are they fresh? Are they added with sugar, or are they fried in sugar? All of these things are going to bring out different constituents of the phytochemicals and the medicine that is in there. So when you're looking at medicine in TCM, Eastern medicine perspective, you're not looking at one singular plant. When you're looking at it in the Western, a good example would be like St. John's wort. St. John's wort is fantastic, and that's found in the Americas, for antidepressant situation. When taken internally, it's a really common tea. Helps to alleviate and calm the body, calm the sympathetic and the parasympathetic, or the sympathetic though. And when you actually make a poultice out of St. John's wort, it's a great pain reliever. It's beneficial for the joints. So there you go, one plant, two uses based on two preparations. Eastern medicine, same sort of thing, but you're going to compound that, where now all of a sudden you have families and how those families interact. And what they do is they actually think of it as you have your main herb that's doing the main treatment, and then you have maybe an envoy herb, so an herb that's going to guide it to, say, the uterus. So say we have a blood moving herb that we now want to guide to the uterus, and maybe these are warming, but maybe they're hot. And the client does not need hot, because not all endometriosis presents as cold. So now that moving is going to be warming, that envoy might be warming, but you need a little mediator to come in there. You need someone else to cool it down, to relax it. Say, hey guys, not too hot, just the right temperature. Or maybe you need maybe you need the herbs to really increase the moisture, to break everything up. You need some blood breaking herbs, some warming, but you still want to kind of balance it out just a little bit with cooling. So there's this huge alchemy that goes along with it. And there's a lot of formulations that, again, based off of 6,000 years of history and documentation, a lot of classical formulations that we still utilize today, which is really very cool. And some formulas might be as simple as 2 different plants coming together. Some of it might be as much as 20 plants coming together. And it really depends on what the circumstances, what the goal and the directive is of that herbal medicine, what the alchemy is, and the desired outcome. And it makes it really flexible and fun and challenging. You know, as a practitioner, it can be challenging sometimes to be like, well, gosh, this sounds great, but I don't know, they have this little part over here that doesn't sound so good with this. And so it can be really flexible and fluid, and there's a lot to discover with it. And absolutely, yes, I agree. Herbology is complicated. You can, as you were saying, Cam, you can mess yourself up with herbs. And if you aren't sure about something, it's always going to be good to some information for you.
For sure. That's, I mean, they're very
I
powerful.
hope I'm still good. My internet's doing something weird, it looks like.
Looks like you're back though.
Okay.
Yes. So before we move on to the demo, I just want to reiterate, because herbs are kind of like, it's very talked about right now with everything going with COVID, everybody, natural solutions, but just, I'm a DIY girl through and through. Like you give me Dr. Google and I will find something. But I wouldn't dream of like ordering any herbs like this, because plants are so powerful that I want somebody to work with. And in fact, what I do buy from you, I know I can't get on the internet. It's, they sell it through practitioners, which I think is great, because plants are natural and powerful. So let's talk about that demo. Show us a little bit about what we can do at home to prevent some stress and to relieve and to increase immunity. Can you hear me?
I'm working on it. I think I'm going to change over to my phone.
Okay.
Okay, hold on. Oh, so sorry.
There we go.
I am so sorry about that.
There we go. No, don't worry. That was a quick, I'm impressed with your seamless transition right onto your phone. That's impressive.
Not just the internet. And I'm sorry to say, but I missed that last part, Kim.
I was just going to say, I'm impressed with your quick turnover right onto your phone seamlessly. So good job.
Thank you.
Yeah. So yeah, show us what we can do at home to kind of help as we're feeling stressed and want to relieve some stress with some acupressure.
Sure. Okay. So I'm just going to get this light. Maybe not. Might be a little too bright. So this is on my phone now. So bear with me. I need to. Okay. So this is my office, my materials. And then just to give you guys an idea, this is an example of the meridian system. All those little dots that you see everywhere, these are all going to be traditional acupuncture points. One's today, so with stress and everything, and we thought it might be kind of fun, and there's a little bit of a limitation in regards to what we can do online. Let me just grab this off just in case I need my neck at all. So with acupuncture, we're actually putting a needle in. With acupressure, we can massage. And as I mentioned earlier, you know, pressing a location of this nature is really beneficial for, say, a headache. There are other places that are amazing. So I'm just going to share a couple things with you guys, and then I'll actually show you just a little bit of like a facial relaxation or uplifting sort of thing that you can do at home. So this is going to be really great for headache. You can just press on it, mash on it. It's right at that muscle of the hand there. I do not have a headache, and this point is still sensitive. And as I push on this side, I am also pushing on this side. So I'm kind of grabbing it and squeezing on both ends. Yeah, it's pretty sensitive. And that point not only helps to work with the head and the neck, but if you massage this, again, along with that location in between your toes, where this thumb would be the big toe, if you massage these points in tandem or back to back, it is going to help to calm down and alleviate and get things moving. So if you're feeling really stuck, this is going to be great. Just press on this area and then that spot on the toes. You can finish that with kind of pressing and massaging, even just along the central midline. So when we go up to the top of the head here, this is going to be very uplifting. Now, some people, if they have a headache in the top of the head, it might be actually very releasing for them. For others, if you're tired, if you're fatigued, if you feel stuck, if you're depressed, if you're not feeling motivated, using this point here and just pressing it, or even just tapping on it. Personally, I love tapping on this, or you can even just kind of pat the top of your head. So acupressure is not just about pushing. It can just be stimulating that area. So whether it's a tap, a light hit, or a nice pressure, you're going to be doing acupressure. with all those techniques. You can also, with acupressure, you can kind of pinch. So say you have a headache on the side of your head, you can rub your temples, or you can even pinch. And when I pinch, I'm not really pinching to pull the skin. Instead, I'm pinching, I'm just kind of energetically clearing it out and letting my hands hit my face gently. So these can be things just to kind of uplift. Another great uplifting, and this one's a little weird, but if you take your ears and you literally, this one, it does not feel good if you're doing it appropriately, but if you're rubbing on your ear, the tip of your ear, this is going to really bring your focus in. And I just love how I look like a monkey when I do this. This is really going to bring your focus in. It's going to uplift you. You can also pull on your ears, and then to kind of calm it all back down, you pull downward. And you can even hook your finger in there and pull downward on the ears. And so a little up and a little down, a little up and a little down. And you can see how my ear's getting red. So it's increasing the circulation in the entire ear when you do this. And that, being that there's so many nerve endings in the ear, it's mostly cartilaginous and nerve endings in there. So it's very sensitive, and it links into the entire body. As an acupuncturist, I can work with the entire body just on this. And I'll often utilize something called ear seeds, which are awesome. And they're just little tiny seeds that will go on locations here that can manipulate that the points that I want. So if I have neck pain, maybe I'd put an ear seed here. If I'm stressed, I'd put an ear seed here. If I have liver detoxing, maybe I'd put an ear seed in here. If you guys want to know more about that, there's a great company called earseeds.com. And let's see, I think my affiliation has maybe gone through. We'll see. But earseeds.com is absolutely amazing. And Alethea Healing Acupuncture, you can see if I'm on there yet. I think they give you a little bit of a discount if it has gone through. Let's see. So ear seeds are awesome. I will send most of my clients out because the ear is the microcosm to the entire body being your macrocosm. So the other thing I want to show you, and Cam, how are we on time? We doing okay?
We're doing good, yeah.
So other things, respiratory considerations are huge these days. So I want to show you guys these things. So the lung meridian will start in this armpit. And I'm going to just kind of show you where I mean. So if you have the armpit here, and you can kind of feel right under the clavicle, right under the top of the shoulder blade, there's a point right in here. And then you can follow that out. It's just on the other side of the muscle, the pectoral muscle bundle here. And there's 2 points right on that inner part of the shoulder. These points are awesome to press and to massage for the lungs. They'll enhance and increase your lung capacity. They can calm asthma. They can calm cough. Another really good one is just central in the sternum. This can calm any sort of anxiety, as well as helping with any, say you have a chronic bad cough, which of course is a major concern these days. Pressing on these 2 points can help to calm that down a little bit. Might need some other techniques too, but this might be of assistance. So with asthma, these are great points. Difficulty breathing, enhancing the lungs, immune system and function, they're going to be great. Other really great ones, say you are an asthmatic. If you go to, this one might be a little harder for me to show you, but if you go to the top of your shoulder and you kind of just, you find the, on your neck, so find the big bone, and it's just below and out to the side of the big bone. So kind of big bone, you can see on my thumb, let's see here, thumb, top of the shoulder, and it's a point right in between. And if you're an asthmatic, it's just kind of like that nape, right at that nape area. And this is going to be really good also for helping to increase that circulation and to reduce the asthmatic wheezing, the difficulty with breathing, and help to open those bronchioles and alveoli up. So with a lot of asthma clients, I'll recommend, or people who are wheezing or having difficulty breathing, rubbing on the inside here, and then just rubbing at the base of their neck, but lower, like where I showed you before. The back ones are a little hard, so if they can't find it, they're not sure, just say, rub the painful point. You always, one of the great go-tos is to rub the painful point. One more immune boosting thing, and then I'm going to show you guys one other thing. One other immune boosting thing, and I'm going to bring you down here really quick, is that you can boost your immune with your leg. So here's my leg, here's my knee. My kneecap is right here. The shin bone is right here. And it's just on the outside. And I don't know if it's working. There we go. So it's just on the outside, right out here. So kneecap, bone, and then it's just on the outside. It's not on the side of the leg, so not on the side, but it's right off the bone, right in through here. This is going to be, you can Google it for reference.
It's store here, yeah.
ST36. So for immune stuff, ST36 and LU1. So these are your stomach 36 points and your lung 1 point. So this is lung 1 and the one on the leg is stomach 36. And those are going to be great for boosting the immune system. Last thing, because this is a longevity and vitality, and let's face it, being our best selves often comes in with making sure that our physical body is being cared for, that we are loving on ourselves, and one of the best ways to do that is through reducing stress and just the basic act of touch and uplifting. So really nice. And some of these things are also going to be good for headache, sinus congestion. They can even brighten the eyes. So bringing energy into that face is pretty much where I'm going to take you guys next. So what I like to do is take my fingers to the outside of my nose, and you can rub right in here. So you just kind of rub around.
That feels good.
It feels really good. Sinus congestion, this is going to be awesome. You can take that and you can even go under the eyes. You'll notice there's maybe a little divot.
Yeah.
Under there. Or you can go under that still to the bottom of the jawbone. You guys can see how my cheeks are slowly just getting rosier just from this little bit. You can take that out and then bringing it up. You can follow that down. A downward motion is nice and relaxing. Follow it out and up. So this can be really good for helping to not only relax because you're just soothingly moving something around your face, but you're also uplifting the tissue. So when you're moving down through the central part here along the nose, really just coming into that gratitude and really just feeling like, here I am. I mean, third eye, a lot of people will third eye it down, and then the uplifting facial component. Now, if you want to, you can always include a little twist and spin, and then bringing it up. With massage, you can lift anything up. Just the act of pinching your cheeks, just the act of pinching your eyebrows, of pulling back on your face, of pulling back on your forehead,
top of your forehead. All of these things are going to bring that energy into your face and flush it back. So again, really good for headaches, but also good for just general facial kind of stuff. I like to do this kind of every morning, and I'll start with that cheek area, and then I'll move down and I'll go to my lips, and then out and around. So I'll go back down the center to my lips, out and around, and really, allowing myself to lift my cheeks up, and then bringing it back down. You can either go around the nose or down over the nose, and then around the lips, and then out. And again, just.
And she has beautiful skin. I think like my second session, I was like, what do you do on your face? Why is it looking so good? Can we do some points on my face? And like, it's just like, it's bringing the intentions and flow to your face naturally. And I love that, because I mean, look how beautiful her skin is. Like, even in person, I think it was the second one. I was like, what you doing? Can we poke the face? Like, let's get this going on. But just treat your face well.
Well, you can treat it well, and bringing it back and even lifting, up and through the neck, and just doing all of this gently. This on the neck, actually doing like an upward kind of motion. And to give you guys an idea, I'll be 40 this year. So I'm not, completely experiencing what might the future hold. I do not know. But this is a tried and true sort of motion where you're constantly lifting up. There are facial yoga techniques also out there. Those things are really cool. There's one woman in Japan, she's in her 60s or something, and she looks like she's 30 years old. And her whole thing is facial yoga. There are also other techniques. We do acupuncture for facial considerations. As of right now with the whole coronavirus, those are non-essential situations. So you're going to be pretty hard pressed to find a facial acupuncturist. The other thing that we can use is to do some cups. So cupping is not just for sports therapy, but we can also apply cups and literally lift. And if you guys see what's happening, the cheeks are just getting rosy. So right before a picture, I'll actually take a cup and just gently. And this is, kind of the same thing as your grandmother pinching your cheeks before family photo. She would do that because it would get your cheeks all rosy, gets the blood circulating in there. And so
it's good for aging. You can get sets of them on Amazon or Etsy, and you get all different kinds. And it's something I'm experimenting with too, because you want to look good when you age, and it's nice to have natural solutions that are like this. So
they're awesome. The facial cups are amazing. And I'll tell you what, this is getting a little more in depth with it, but I have had a lot of neck and shoulder clients where a lot of that neck congestion and pain comes because the breasts are heavy and maybe they're sitting and lifting, sitting over, and the pectorals are very tight. And so I'll apply cups in through the upper pectoral area. And I've had a few clients mention how they'll go home after a session. We would have done some cups here, and their husbands notice or their partners notice that their breasts are a little more perky. So there's some interesting stuff on that. I haven't seen anybody really coin off of it or anything, but I think it's I think it's reasonable if you're pulling the tissue in through this area, and if you're uplifting it, then why would the breast tissue not also be uplifted?
Well, at least we're home and we have some new DIY anti-aging techniques. I'm excited about that. Guys, I want to, thanks for taking extra time and showing us, like, this point feels amazing. I'm going to be doing some of these. Like, I could do this all day. I like that. Do you guys have any questions here about anything we talked about? I'm going to be sending an email around tomorrow with a little bit of this information and all the ear seeds. I'll give you the link directly to her site so you can get the discount, because she has, it's interesting. I've had them in my ear before because it just kind of gives you slight pressure for like a week, just where it needs to be. And so I'll get that around, but I want to open it up to questions. Anybody have any questions? I don't see any questions. Well, Thank you for taking extra time. So we actually have one. I'm hot cold. I'm almost always cold. What would be something that Carla could do to help with that?
So not knowing anything else, because there are a lot of other considerations that can go along with hot cold. One is that hot and cold can come together, and you can present in both manners. Maybe not you specifically, but a person can. So when you're predominantly cold, best things to do, and this is just top 3 or 5, not knowing anything else. If you are not during cold temperatures wearing a scarf of some sort, I'm also predominantly cold, and I noticed that as soon as the weather changed today, I said, okay, great, I am going to cover my neck up. So number 1, cover your neck, cover the back of your neck here. This is really good for immunity, to tell you the truth, because what are the first things that most people get sick with respiratory wise? Sore throat, cough, upper back tension. So when you have a scarf on, it can be really beneficial. Other great things, ginger tea is amazing. You can actually, if you're very cold, if you're prone to feeling very chilled, your joints are very cold, you can do a ginger bath. And what you do on this is you want to take about 1 pound of ginger to 1 gallon of water. Chop your ginger up into pieces. So dice it into pieces, about so big. Put it into the pot of 1 gallon water. Bring it to a boil, and for about 10 minutes, 5-10 minutes, and then simmer until it's a golden yellow color or a golden brown color. What you're going to do then is you're going to drink 1 mug, 1 cup of that. Drink 1 cup of that. Take the rest of the tea, filter it through a strainer, and drop it into a warm bathtub. So what you're doing is you're taking that ginger tea internally and you're soaking in it. So that warmth from the ginger warms everything up. It is so delightful.
That sounds like self-care at its best.
It's really delightful. It is possible to very much sweat during this time. And that's okay if you're gonna sweat, but if you end up sweating quite a bit, I want you to wrap yourself in a warm towel and a warm blanket, because what this is doing, this is warming the body from the inside and pushing that cold out and away from you. So it opens the pores, it gets everything moving outward. When you open the pores and you get everything moving outward, you have to protect that warmth. So the way that you protect that warmth is by wrapping in a blanket and a nice robe after, and just keeping yourself warm. So it's best to go to bed after doing something like that. One other idea on body temperature regulation is that a lot of people benefit from just a cold flash, and this might seem almost opposite, but if you do a cold flash of water in your shower at the end of a hot shower, a lot of people notice body temperature regulation, because what you're doing is the hot water increases the circulation in the body, and the cold water squeezes everything together. It constricts the whole body. And when it does that, our lymphatic system gets constricted, our circulatory system gets constricted, everything gets constricted, and everything gets kind of primed a little bit. So you can do warm water, everything circulates, cold water constricts. Really awesome for body temperature regulation, and especially lymphatic drainage and regulation.
You taught me that. If I ever feel a little bit icky and not very good, it's the worst. Like, don't get me wrong. You get in a hot shower and you're enjoying yourself, and then you're like, Okay, and getting yourself cold, like turning it on like a very quick flash just so it drains, but it's like she taught me that it was like your body was a sponge, so when you're hot and warm, everything is absorbing, and then you squeeze it all out. And so it's amazing how much better you feel after you finish chattering, but it does it just like it gets everything out that needs, it flushes it out. Eat well, have some tea after that. But that ginger bath. It looks like we have one more question if you have time, and it's about helping your face from breaking out.
So Cam had mentioned how she asked me about skin stuff immediately. And one of my favorite things to do for my skin, and my mother, you know, when I was 26 years old, my mother introduced me to facial products, and I was like, God, Mom, that's for old ladies. What are you doing? I don't get it. And I'll tell you what, 16 years later, something like that, I'm really grateful that she did that. 15 years later, something like that. I'm really grateful that she did that. But one of the things that I have found on my own is that I love calendula oil or calendula salve. And calendula is Calendula. Calendula is a plant. You can actually harvest it and make your own salves, make your own oils, and it has this beautiful golden color to it. When you're talking about skin is the exterior emanation, potentially and likely, of something that is going on inside. So in Oriental medicine, the skin is linked up with the lung meridian. The opposite of the lung meridian, the yin-yang pairing, the husband-wife, brother-sister pairing, is going to be the large intestine meridian. So when we see something with the skin, first thing to do is to look at, did I have anything different to eat? Did I have anything, there could be some underlying things going on, and acne on the skin really is going to vary on what that means based off of, is it a dry acne? Is it a pinnate, like a blackhead or a whitehead? Is it pustular? Is it abscessed? All of these things are going to give you different information for how to approach it from in the body. If it's abscessed, if it's pustular, chances are you have too many phlegmatic things coming into your world. This might include high sugar content, high carbohydrate content, too many fats and oils. Maybe your body doesn't need that many fats and oils, if that's what it is. It might also be in part a detoxification process. I know when I detox, I get more acne because my body's pushing things out. So there are going to be a lot of circumstances that come along with something like acne. If it's a dry acne, you might need more oils, you might need more healthy fats. You nourish your blood. So it's really going to depend in regards to that. But I love calendula salve, calendula oil, and I think that's a great place to start.
No, it's amazing. I've come in to see you before. I'm like, look, I have a little inflammation, and you treat it instead of like a hormonal acne. You look and how's my blood in it, and it's just a picture that even just the type of pimple you have can make a big difference. But I have used so much of your time. Thank you so much for coming on. I can listen to you talk all day. The knowledge I hope you know that you have from head to toe, in and out of the body, is incredible, and I feel very fortunate to have you on our call today. Thank you so much.
Thank you. It's
I
my
hope you
honor.
see the compliments that you're getting here, because it's very clear that you in and out look at everything. So she's got a blog, guys. I'll send that around on my post so you can take a look at it and get to know her more. I've been very privileged.
Don't judge my computer content, though. It's something I very much need to work on. So, but I'm getting there.
It's a lot going virtual. It's a crazy thing, but thank you again, everybody. Thank you for coming on the call. I look forward to getting back in. I've definitely missed it. Have a great rest of the week, everybody.
Thank you, guys. Appreciate